So I'm Laura Wolfscharndl, Mr. Wolfscharndl's wife, and I'm originally from Georgia, and when I was a teenager we moved to Arkansas. That next summer my kidneys failed, and after a year on dialysis my dad gave me his kidney. I moved up to Joplin to go to college at Southern, and I met Mr. Wolfscharndl. And we've been married for 15 years, and we adopted a beautiful little girl from Taiwan. I work at Freeman. I work in the admission discharge lounge, and for somebody that has like chronic health issues like me, it's the perfect job. It's kind of like a very laid-back ER. Well, I had been having some belly pain, and after you have something serious like a transplant, you kind of get almost hypochondriac about everything, you notice every little thing. And so I was keeping an eye on it, and I had went to my doctor, and but all of a sudden it got really worse, so we ended up going to the ER, was in the hospital for like 4 or 5 days, and they finally decided to do surgery, and they took out a mass. And I felt so good after surgery. I was like, woohoo! I felt like getting up and dancing. But right before I was going to go home on that Friday, the surgeon came in and said that it was cancer. This one is non-Hodgkin's diffuse large B-cell lymphoma, and according to the pathology, the cells is a more aggressive type. The good thing is that they think they got it all out during surgery, so I could be 100% cured right now, but we're doing the chemotherapy as a precaution to make sure that no other crazy cancer cells are running around in there. So I get to do a couple weeks of a couple rounds of chemotherapy, and hopefully it won't come back. The interesting thing is that the cancer was caused by my medication for the transplant, and so they're taking me off that. Yesterday was the last day that I took those drugs, and it's very unnerving. It's very scary to me because I've been on those for so long. So I'm nervous about what's going to happen. I think I'm more nervous about the kidney than I am about the chemotherapy. Usually they like to do 6 rounds of chemotherapy, and that's 1 week you get chemotherapy, and then 2 weeks they just monitor you, and then it's every 3 weeks. Because of my kidney, they want to protect the kidney, and also because they think that they got all the cancer. They did several scans of my body and they didn't find any other cancer there, so that's good. They are going to do shorter rounds and like a decreased dosage, so hopefully the side effects won't be quite as bad. But hair loss and nausea and vomiting are the ones I'm most concerned about. Hair loss, there's not anything I can do about that. The nausea, they give you a whole bunch of medicine that you can take if you need it, and they recommend that you just start taking it the moment you start feeling sick to your stomach. So I'm hoping that won't be bad either, but they said that you can start having numbness in your fingers and toes, but that hopefully will go away once you're done with it. Oh, and the main other two are fatigue, being tired all the time, and risk of infection. And they're really worried about that with me because I'm already so suppressed with my transplant medicine. So I've got that, and then now I'm getting the chemo. So they're really worried about that. They have to implant like a big circle thing in your chest, and it's connected to all these blood vessels, so it's basically like a permanent IV for a while. You don't have to necessarily have it for years, but they want you to have it while you're having the chemotherapy. Normally, you can see the circle very easily. On a lot of people, cancer patients, like you can look it up online and you'll see like the big circle right here. With mine, he did such a good job you can't even see it. Like it's just flat. You can't even hardly see it. The only problem is it's almost too deep, like they had to use a really long needle. But like Steph thought it was something, this is not normally here. This is what they put on there to do the chemotherapy for the next couple days, and then they'll take the needle out, and then it'll just be my skin, and I can go jump in the pool or whatever. And then whenever I have to do chemotherapy, they'll put the needle back in. Well, one of the scary things was when we were going to the doctors, they said that some of the transplant people that get this, they get it in their brain. And so when I heard that, I was like, man, you know, it could have been so much worse. And in my job, you know, I see people every day that have it, so they're going through so many things that are worse than what I'm going through. So it's, you know, it helps me think, hey, I can get through this. I'm going through chemo, what, you know, it's not the end of the world. Saying that, I don't think that I could be so positive if I didn't have Mr. Wolf, because he's, you know, he's my main support, he's my best friend. My family is actually one of the, they're my best medicine, I think, you know, because this is very stressful, and I know that I have Mr. Wolf and Grace to help me keep things in perspective. They make me laugh all the time, and I think that's, you know, the best thing, just to help relieve stress. My parents moved to Joplin like a year or two ago, so they're here to be a support system. And we've just had so many people being encouraging and wanting to help. That's all I can say, because I'm gonna start crying.
You miss your hair already?
No, I don't. It's weird. I mean, yeah, I miss it because it took so long to get it that long. You know, I've had it that long for a couple years now, and it's weird thinking about it being gone. But no, I'm just trying to think positive and think about all the good things that I won't have to deal with that long hair.
I've known her for several years, lots of years, and she never gets down. Even when there's something to be down about, she refuses to not smile, or she's always looking for a way to cheer somebody else up. Even with this experience, like the second day after she found out she had cancer, she was like, what can I do to help other people that are in this situation? And I just feel like that's an honest picture of her heart and how big it is, and she'll be stronger after this experience, especially with all the support she has. So I'm proud to be here with her and all of what she'll go through next. So,
you know, I think having that kidney transplant so long ago, I'm able to look back and see all the good things that God did in my life because of that. You know, like, it's really cool to look back, and because I had the transplant, I moved to Joplin, and I met Seth, and, you know, and I think that helps me have a good perspective, because I know that he's able to do even more than I can imagine out of this. You know, I can't shut my brain off sometimes, because I'm like, ooh, you know, we could do something like this, and you know, give you guys a learning experience, and hopefully it'll help somebody else that's going through this, or, you know, maybe their family member is going through it, or hopefully none of you guys will have to go through it yourself. But so this is me at 3:30 in the morning. When they started the actual chemotherapy medication, they put me on a lot of prednisone, which is a steroid, and that made me very jittery, and it makes it hard to go to sleep at night. And I have trouble, if I wake up in the middle of the night, going back to sleep. I worked on Saturday, and that was an adventure. Simple things, you know, like changing a dressing on a central line, something that you have to be very steady for. I had a patient that needed one of those changed, and I didn't feel comfortable doing it because my hands were shaky. You know, if I'm going to be able to work through this, I have to know my limitations and be willing to ask for help when, you know, when things aren't going well, when I'm having a bad day, when I need to go snack on something so I don't get sick to my stomach, or if I don't feel comfortable, if I'm too shaky to start an IV, some of that, a lot of that depends on the day, what's going on. My coworkers are awesome, very supportive. And one of my coworkers, Dixie, she used to run the Freeman Cancer Center. So over the last 2 years, I have listened to her counsel people going through chemotherapy and cancer, and I have tried to get as much from her as I can. And I think that's one of the things that has helped me not be freaking out about this, because, I know that it's going to be okay, and I know that I have my own personal advocate, Dixie, that'll help me get things straightened out. It's cool to look back and see how God has led me and our family into this current position, and we are excited to see what He is going to do with this. Hopefully, it's more than about what's going on with me. It's about how can we help other people. We just have been blessed with the outpouring of people that support, that have come, wanting to do stuff for us, just sending us a beautiful note on Facebook or a card. People that I haven't even heard from in, years. And it's very humbling, but it's just an amazing feeling to feel like you are that well supported. Okay, that's all I got. Bye-bye, good night. Hope you're sleeping right now. Bye-bye.
My name is Alyssa Brown. I've known Mr. Wolf for 2 years now. I started taking his art classes when I was a junior, and I took a lot of them throughout my senior year as well.
My name is Ashley Zumwalt. I have been in Mr. Wolf's classes for 2 years now.
My name is Lauren Brown.
I've known Mr. Wolf for 2 years now. I've been taking his classes since I was a junior.
Our sponsor from Black Ops came to us about one of our favorite teachers and told us about what had been happening to his wife. We all stepped up because we wanted to do something to help her, and we came up with the idea to do a documentary, and it was something we all really wanted to do and we all really care about.
I did the documentary because I wanted to help Laura and her family, and that was really the one thing that she really wanted, and I felt like that was the one way that I could really help. I wanted to do the documentary because I wanted to help one of my favorite teachers, and this was one of the ways I could.
I've been thinking about how it says in the Bible that, God knows He knows the number of every hair on your head. And so in my crazy imagination, I've just been thinking, He's like, okay, there you go, Laura. You see that little white hair that's coming out? You've been thinking too much about the past. There you go, let it go. And this brown one right here, you're worried about the future. Let it go. He knows everything about me, and He knows what's going to happen in the future. And, you have to stay positive, and like I've said before, my job is such a blessing because I get to see people that are going through so much more than me. I mean, you don't even know people. What I'm going through is nothing compared to what I see at the hospital. Oh, get choked up. But it helps me keep things in perspective, I can get through this. 5 years down the road, if I need another kidney transplant, well, that's okay. We'll deal with that then. In the past, they've said that I might need, my airway is 50% blocked off. So there's a chance in the future that I might need a trach so I can breathe. But, that's, God's only going to give me what I can bear right now. So we will, if that comes, we will deal with it all then. Right now, other than having trouble sleeping every once in a while and very mild nausea and hair falling out, there's not much going on with me right now. I'm feeling pretty good. And I just am thankful for the health that I have and the many blessings that God has given me. So what do you think about all this mess?
Kind of a mess. I don't know.
Do you think it's gonna be crazy when I don't have any hair?
It would probably scare me.
I think it's gonna scare the whole of Joplin, but guess it'll be okay. That's
If you
what we
would
have.
wear a wig.
That's what we have wigs and hats for, and one of these days I might just be crazy and just go without anything, just be bald. What do you think about that?
Everyone will be freaking out about you.
Is everybody gonna be like, run away?
Everyone for your lives.
Do you know there's lots of people that have cancer that have bald heads because their hair falls out. You know why their hair falls out?
Why?
The medicine makes it falls out. It's attacking all of the fast growing cells in your body, and guess what? Grows really fast. Your hair.
Stupid mess.
Stupid hair. My hair started falling out a couple of days ago. It was just one piece at a time. I noticed that my head was feeling sensitive, like right around here and in the back. Not an actual pain, but it was just like tender without even touching it. And like this morning when I was shampooing my hair and I got done and I looked at my hands and there were like hairs all over my hands. And then I went to go try on some wigs today, and they put this crazy pantyhose cap on your head, and when she went to take that off, there was a ton more hair. And it's just like every time I run my fingers through my hair, there's hair. It's just coming out. And I wanted to do it now because it freaks me out, the thought of waking up and having big clumps of hair gone on the pillow or whatever. And I work on Thursday. I don't want to wake up and look like a mangy dog, with big clumps gone. So I want to just get it done and not have to worry about it anymore. I'm tired of messing with it. Even though I love my hair right now. But I just don't know that it's worth, like the wig expert. She said it's just gonna get worse. You're gonna have it in your food. At work the other day, I kept noticing it in my glasses. So I'm just gonna get it done. It freaks me out. I feel sad. Probably gonna feel more sad than I thought I would be. But we'll see. It'll be okay.
Art Fest was a collaboration between our film club and the art department.
We had so many meetings where we just sat down and deliberated what we wanted to do to help the Wolfstornder family.
We wanted to do something to help raise money for Laura's chemo, and so the Black Ops team just kept saying, well, we could do an art auction or we could do art classes, and eventually it just turned into this giant event where we had art classes like spinning pottery and paper quilling and tie-dyeing, and people would pay to take a class. And we had an art auction and live music.
We auctioned off the art pieces that had been donated by local people and mostly students. Like the whole school just came together and just donated stuff just to help us out. It was so nice.
We had really generous sponsors who helped donate food and time and volunteers, and it was really awesome. We raised over $1,300 for the Wolves, and that money went to Laura for her chemo.
Everyone just really came together, and we had so many people show up to help, and it was so awesome. We raised well over $1,000 to help the Wolfstornder family, and it just felt so good to be a part of something that just helped them so much.
So I've been up since 3 o'clock in the morning, and it is 7:30 at night. I did take a power nap around 1 o'clock because my mom was nice and picked up Grace from school. Thankfully, my mom and dad live close by, and they were able to watch Grace and help me whenever I call them. Right now, I'm feeling good. This was my second round of chemo. I got a shot today to help make sure my white blood cell counts stay up, and that means that if they stay up like they have been, I don't have to wear my mask around people. There are certain things that I can't do, like I can't go to I'm not supposed to go to buffets, which we don't do much anyway, but just as long as those numbers all stay good, I can act relatively normal, which I've been really happy with. They say that this shot can cause a lot of bone pain, but so far, the first one, it didn't do anything to me. So I'm hoping that I don't wake up this weekend and feel bad, but other than being a little tired, Seth and I were talking today about how it feels like kind of a weight has been lifted off of us, because we know that, I've passed 2 rounds already so far, with this week, and done pretty well with them, and so we feel very blessed. But I'm just so grateful for all the encouragement that people have given me, and just for all the many ways that God is blessing us and showing us that He has a plan for this, and we're just excited to see what happens with it. Okay, so I'm gonna go ahead and take off my hair. You can film it, I don't care. So we finally got tired of, Seth shaved it really, really close, but then I looked in the mirror and I'm like, ooh, because you can see the bald spots. Like, I have one right there, and this side is getting really bald. And that's been 2 weeks, and I haven't had to shave it. I probably should, because it's starting to kind of grow back in the back, but some days I'm just when it gets hot, I'm just whatever. But I got my hats, and I used to wear these to work a lot, because they're nice and comfortable. And these are reversible, but the only problem with these is, when I wear my glasses, it would push them down and kind of hurt my nose. So I got kind of different colors. And I had to take them to my hairdresser to get the bangs trimmed up, because they were driving me crazy. It's kind of hard to do this with my hair. It's hard to tell how I look with it. I got 2 long ones and 3 short ones. I got one that's a little redder than that one. And I have a blondish brownish one like this. So it probably looks crazy because you can't see it, but it's weird. I thought the long ones I would be able to put in a ponytail, but then you have all this. I don't think that's gonna work, but I might be able to do a wrap or something. I don't know. I'm still playing with these long ones. I got this one because it looked kind of like Grace's hairstyle. And I thought, hey, why not? Let's try it. And it's kind of hard to tell on here, but is it crazy? Anyway, I'm gonna play with it. But that's probably my favorite. That's the one I'll probably wear the most. I talked to my aunt the other day, and I have several people tell me this, that, you're so brave, and I don't really feel brave at all. I mean, especially being in contact with all these people here, and I'm on a Facebook support group with some ladies that have breast cancer, and so I can read and see pictures of what they're going through. And my treatment is nothing compared to what their treatment is. I mean, they have a lot more trouble with nausea and vomiting, and there was a picture of a lady that her nail beds were all red. It was like somebody had smashed a hammer on all of her. And you know, that's because this is fast growing too, you know. But everybody's treatment is different, and I'm like, mine's not too bad, you know. I don't feel like I'm really going through much to be brave about it. Yes, I don't know. It's weird. The kidney doctor came in, and he said, when I told him that I had lymphoma, he's like, oh yeah, that's from the meds you've been taking. It's PTLD or something. I'm like, oh, how, you know, I'm thinking in my head, how come nobody's mentioned this in the last 10 years, you know, 20 years? But, I mean, I was a teenager when I had the diagnosis, so maybe they mentioned it, maybe they didn't, maybe they didn't want to scare me, but I know nobody's talked about it since then. Like, you know, there's part of me like, how come nobody told me about this? And, you know, I asked Dr. Hassan, I'm like, is there any way they could just do routine scans on people that have had transplants over 10 years? Yeah. You know, but even mine, if they would have done my scan at the beginning of the year, I would have been clear, because she said that mine grew within 2 to 3 months. Wow. And so, I mean, it's just, the cost is too crazy to do that as often as you would need to catch something like that. But it still makes me think, if you have had a transplant over, you know, if you've been on those specific medicines for over 10 years, you know, it almost makes you...
take them the whole time?
Yeah.
Oh, wow.
Yeah, I was on Imuran for 20 years. I was on Program for 10, but I'm sure the other stuff that I was on caused the same thing. I have my med instruction sheets at home. I haven't looked at them, but we printed up one at the hospital, and that was the first sentence. Really? If you have these drugs, you're more at risk for lymphoma and leukemia. And I was like, well, yeah. You know, and I don't know at what point they discovered that, you know. Maybe when I first had my transplant 20 years ago, they hadn't made that connection yet. Right. But it just makes me want to tell everybody that's had transplant, be careful.
Have you ever looked into what percentage of that occurs? I mean, it makes me wonder if you are unique to the situation, or if it's a lot.
I think I'm totally unique, because when we went up to Barnes, they had a protocol already established.
Oh wow. Okay.
And well, because they're the ones that said, hey, you need to get off this stuff right now. And you know, that's the
red flag.
You know, that's probably the scariest part of all this. The other stuff was the hardest part, but that is the scariest part, because I've been on those medicines. That's been my not lifeline, but you know,
yeah.
I have depended. Yes.
Like, you know, you're in good shape.
I know. I've got those meds. Yes. And for so long, it makes me very nervous to be off of them. But they said that while I'm on chemo, while that stuff is in my system, that is doing the same job. It's suppressing everything. But I'm like, okay, so after the next 3 weeks, that's going to be out of my system, and so
what then?
We'll have to monitor my kidney. And
but they're not going to replace it with a different drug?
Not right now. My numbers, my creatinine, which is kidney function, it's already going up. Like, there's already been a little bit of kidney damage. But, well, I guess I shouldn't say that, but you know, this chemotherapy, they told me that you could lose a little bit of kidney function. So I kind of, you know, expected it. I was hoping that it would be better, but we'll have to see what this round does to it. So, I mean, worst case, dialysis, because I have to be cancer-free for 5 years before they give you another transplant, unless I get one from a living donor, but I don't know. I don't know how good that's going to work this time.
Every patient's chemotherapy is a little bit different. They see the physician after their diagnosis, and they go through chemo education with our nurse practitioners, and they give them all of the information of possible side effects. They talk about how it may affect them in their nutrition, how it may affect them with their fatigue in their family life, including their job. And from there, they come and see us in the chemotherapy room, and we do our best to answer all the questions that they didn't get answered. And I mean, there's always questions, and there is no such thing as a stupid question, because if that were me sitting in the chair, I would still have questions, and I do this every day. So once they come into treatment, you know, we have to have all of the consent signed. We access the report. They all have pre-meds that entail for nausea, and it's a lot different now than it used to be. And the nausea is not, you know, getting sick isn't near as bad as it used to be back in, you know, 15 years ago even. So we just monitor throughout the procedure. Laura comes 2 days in a row, and one day is you know, a little bit different than the other. One day we monitor and bug her every 30 minutes during her treatment. And then the next day is it's a longer day for her, but it's not as, we don't bug her as much. She can take a nap and not be bothered every 30 minutes. And then she also comes back for fluid, but every patient's a little bit different. Some patients come every single day, Monday through Friday, for 4 weeks at a time, and then they take a month off. Some people come every 2 weeks. Some people come once a week. We have patients that come like day 1, day 8, day 15, day 21. So it just depends on the type of cancer and the different regimens that they're on.
One of the medicines that I'm going to be taking today, it can cause neuropathy, numbness in tingling in your feet. And I was telling her that I was having some dizziness, and we noticed that my blood pressure was getting lower, and she says that medicine can affect how well your body regulates the blood pressure, and it also she was tapping on my knees with the hammer, and usually I'm really jumpy, but this time, like, it didn't even move. I'm like, oh, that's great. You know, I guess I'm losing some reflexes or stuff. But, you know, other than the tiredness, I haven't had any trouble with throwing up every once in a while, nauseated, but I take my medicine and it goes away. April, who was just here, she actually got hired on in my department kind of as needed, but I had never met her until she treated me here, and she's kind of the one that I have the closest bond with. But, you know, everybody has been so friendly here. I mean, even people that I don't know, like these office nurses here, they'll come by to get a drink of water and they'll start talking to you, and the nurse practitioners, they come and they're like, how are you doing? And I had one of the social workers come by yesterday and sit down. I mean, dietitians, they're all so friendly, and you know, even though you hate being here, you know, you kind of, they make it better. Probably the hardest part of this whole time has been at the beginning when, like, we didn't know where all the cancer was. Like, we knew that we had cancer in the bowel and they took it out, but we didn't know if there was some, you know, in the brain or who knows where else. And then having that scan and then having to wait like 5 days to figure out what the results were. That was really hard. And the other part that has been hard, especially at the beginning, was having to tell your story over and over again. Like, I remember coming back from Barnes and I spent, it felt like 8 hours on the phone with family members, you know, telling the same story over and over again. And so that was super hard. That's probably one of the hardest parts. Well, did I tell you? Did I tell you? Because I, you know, after a while I was okay with it. And so I'd just be like, hey, you know, they'd say, hey, what's going on? I've got cancer. And Seth was like, you know, you could be a little more compassionate in how you tell your story, you know. I was like, oh, well, that doesn't bother me. I didn't even think about it, you know.
Okay, Laura was talking about how compared to what other cancer patients are going through, she doesn't feel very brave because she thinks that her journey is a lot easier than what other people are going through. So what do you have to say about that?
I feel like that's because she's got her clinical background and she knows she is not any easier than what she's going through. She's going through it just the same, and I feel like she is very brave what she's doing. You know, there are some people that their diagnosis is a lot later and their outcome isn't as good. However, I feel like it's just brave to opt for treatment and to go through what you're going through. It takes courage and strength, and even after treatment, I think that she'll look back and think, wow, there's things I don't remember, but it's because she just puts her big girl pants on and does what she has to do. And she's not just a nurse, she's a mom and a wife and a co-worker, and it takes a lot to do what she's doing and go to work every day. That she's going to work and taking care of people too. And you know that there's patients that have to respect what she's doing as a nurse and going through what she's going through to be taking care of them. Because I can guarantee you 75% of her patients aren't as sick as she is. I'll be upfront and honest with you. I have patients and I have coworkers, or not coworkers, other nurses tell me, I don't know how you do what you do every day. Well, I do what I do every day because I love what I do and I love my patients. And I hope that I make as much of a difference in their life as they make in mine. Because I've been a nurse for 23 years and I've never enjoyed my job more than I enjoy it here. So, and I mean, any way you look at it, whether I work in the ER or whether I work here or whether I work ICU, there are going to be losses in your job as a nurse. But you don't get the opportunity to build the relationships that you do when you're here. I don't get to see that patient in the ER once they're admitted. And I don't get to see that patient from ICU go to the step-down unit. But here, I get to see those patients complete their journey. So I can't imagine why anybody wouldn't want to work oncology. So, that's why people say, why do you do that? Why do you work over there? Well, that's why I work here, because I love my job. And that's why. Because as a nurse, you don't get to witness that whole journey.
I've been thinking a lot about transformation. Ever since I found out that I had cancer, I immediately started thinking about how my journey with cancer, how can this help other people? Well, I've been thinking a lot lately about how it's changing me. Like, how is God using this to change me? Because, we look at pictures of me with long hair, before this mess even started, and I don't even recognize her anymore. It just is crazy. And I'm discovering that I have a lot more courage than I thought I did. And I'm finding a lot more joy in things. And I guess I've always felt like I was a pretty happy person, but I don't know. I'm just interested to see what I'm going to become when this is all over.
Laura's the best. I love her so much. She's one of the best people I think I've ever met.
I love Laura Wolfstrandl so much. She is the nicest lady I have ever met. They're just the cutest family. I love Grace too. She is just so adorable, and the family is just perfect.
I love Laura so much. She's so positive.
I'm always amazed how positive she is and how her faith hasn't wavered at all through this whole thing. It's amazing. She's a really genuinely nice person, and I think it's really encouraging that she can be so positive and brave in the face of cancer.
I think that she, Mr. Wolf, and Grace are just the best.
My friends and I were really happy to get the opportunity to do this documentary because we care so much about Mr. Wolf and his family, and we would do anything to help them, and we are just so happy to be a part of it.